This is Bill Schultz, historical writer at the Medical College of Wisconsin, and I have with me today Dr. Janis Orlowski, member of the class of 1982. Jan, thanks for joining us today.
It's my pleasure. Thanks for asking me to do this.
Let's start off and tell me about your background. Where are you from?
So I was born in Racine, Wisconsin. I am the second child of Jack and Joan Orlowski. They had 8 children, so I'm 2 out of 8. And at the, so raised in Racine, but at the age of 10, my father's factory burned down. And so we moved temporarily to the western suburbs of Chicago. And temporarily means that my parents are still living there today, 40 years later, or, 35 years later or so. And so then raised in Lombard, Illinois. I went to Montini Catholic high school in the area, and then came up to Marquette University, where I was a biomedical engineer. And from Marquette, then to the Medical College of Wisconsin.
Well, you answered my other question, was where did you do your undergrad? And you did it at Marquette.
University.
So then that answers a lot of the next question, and that is, how did you end up getting to the Medical College of Wisconsin?
So I would say that there were 2 factors that got me to the Medical College of Wisconsin. The first is that as a biomedical engineering student, I was working with a number of physicians, very well-known physicians at the Medical College of Wisconsin. They were Dr. Jerry Dodds, Dr. Walt Hogan, and Australian by the name of John Dent. And as a senior in biomedical engineering, I was helping them to analyze esophageal and pharyngeal waveforms. And so I did Fourier analysis and other analytics on their waveforms, helping them to understand how to measure normal as well as diseased waveforms. And so this was actually a project that I did my junior and my senior year. And so I was out here on the at the campus. At the time it was Milwaukee County, and they were building the medical school out here. And I have to say that I just became very excited about the interaction between science and engineering and medicine, and really looked forward to an opportunity to continue my career and my interest by going to medical school. Because I knew the Medical College of Wisconsin, it was very natural for me to look here. There was a second thing that happened, and that is that I met my husband, who was my boyfriend at the time, and what we decided is that we were going to get married. And I actually looked into and found out that there was an early decision process. And so my husband said, well, if you can get in at the Medical College of Wisconsin, I'll pay for medical school and we'll get married. And so I actually applied to the only school, which was the Medical College of Wisconsin, and got in early decision. And a year and a half later, got married, went on my honeymoon, came back, and started medical school.
That's great.
Yeah.
That's great.
So it's sort of a combination of personal and professional reasons that brought me.
Well, if Walt Hogan can't keep people in town going to the Medical College of Wisconsin,
exactly.
Nobody can.
Exactly.
Nobody can. You know, your class of 1982 was the first class to actually start medical school in this building that we're in right now. But I've heard stories about cafeteria in a tent, things like that. Can you tell me some of your recollections of starting with a building that maybe wasn't quite done?
So I have a funny story to tell you about that. So at one of the alumni meetings, I mentioned that when I started medical school here, that we had to eat in a tent and do certain things in a tent. And everyone looked at me and said, "You're crazy." And I thought, I think I remember, starting. And they looked back and whatnot, and then found some pictures and like, oh my gosh. And so my recollection, I was a first-year medical student, so what do I know? But I can tell you that when you came into the school, so the front of the school now was not the front.
Right. It was a concrete bunker-type building.
Exactly. It was a bunker type. And you came in, And to your left were the two auditoriums, which are part of the medical education. And I would say that was done, but straight ahead and off to the right, as well as above the school, there were construction guys everywhere, there were cranes, there was all this going on. So we started medical school amidst the school, really the auditoriums just being ready. And so I actually can remember not only lunch being out there, but I can remember being out there with a professor in some kind of a study group or something like that. So my first couple of days were in the tent on the grounds immediately adjacent to the school.
Yeah, and those are the stories that I've heard. So obviously, kind of an interesting start. But during your time here in medical school, tell me, are there any of your professors or instructors that you had that, when you think back, their names, their faces jump out at you?
I would tell you that
stories can be good or bad. We don't care. we can always edit.
I can tell you that there are many professors that I think about when I think back at the Medical College of Wisconsin. And you know, I almost don't know where to start. There's so many good stories. So as I take a look at my first couple of years here, I can tell you that I remember Sally Long, who was an assistant or associate dean. And when I came here for medical school, there were very few women in the class. And they had, in my year, they had increased the number of women in the class. And I think there might have been 15 or 20 of us in the class of 120. And so I remember Sally Long as a role of cheerleader and someone who really just worked very hard to try and not only help all the medical students, but in particular help the women in the class.
Oh, that's great.
The other thing that I can remember is anatomy lessons that include lectures with Dr. Marv Wagner. And to this day, I can remember being so impressed where he would say, okay, now we're going to take a look at the, chest at this level, and let me draw the diagram. And whether it's horizontal or vertical or whatever, these phenomenal diagrams would appear. And the shame is that we didn't have cell phones, no one was taking pictures, but that really is something that was just phenomenal.
The other sad thing is that, unfortunately, Marv, who's in his mid-90s, would not be capable of being interviewed by me, which is sad.
That is sad.
There have been a number that we feel bad about that we've missed.
Yeah.
And what you just mentioned, him doing a lecture like we've heard a million times, to have that on tape would have been so nice.
Yeah. I think the other thing that I remember, I have a funny memory of a pathophysiology renal lab, which I'm sure you could not do today. But what we had to do is they were trying to teach us about the kidney and concentrating. Maybe this is where I got my idea that I'd be a nephrologist.
Okay, that was a down here ways.
But if you had told me that I'd be a nephrologist on the day of that lab, I would have told you absolutely not. But what we had to do is we had to fast from midnight until the time of the class. And then we came in, we were in groups of 6, and you had to drink a certain percentage of your weight. So they weighed us, we had to do a calculation, and you had a certain percentage of your weight in either free water or 0.9 normal saline or urea or alcohol. And then 1 or 2 individuals took intranasal ADH, so vasopressin. And so we then, every half an hour, had to do specific gravities on our urine. And I can remember, first of all, I had urea, which, it's like, oh my gosh, I can't believe I drank, a certain amount of urea. But it was laboratory grade and it was safe. But the funniest was the individual, Bill Reed, who in our group had to drink the alcohol. Oh. And so fasting from midnight and then drinking 4 or 5 beers, let me just say, he was not capable of doing specific gravities at the time. And Bill and I are great friends, and I see him from time to time. And whereas I remember that lab and how funny it was, he has no memories of that lab.
I would guess. That's a great story. That is really, that's a good one. During the time you're in medical school, 1978 through 82, and then on to where your residency, can you think of any key events that were happening here in Milwaukee at MCW or worldwide? I mean, this is, I've heard the Vietnam stories and Korean stories and others, but anything that you can think of other than the Brewers making it to the World Series in 1982?
So, as far as world events, I'll have to think about that. I actually, one of the things that happened on campus is my class was not only the first class that started out here on the county grounds, but when I was a junior and started my clinical rotations, Frederick opened. And so I can remember very clearly wheeling patients from county to Frederick. And there were a couple of things. First of all, there was carpeting on the floor. It's like, who is a hospital that there's carpeting? And sure enough, one of my patients, ended up having an accident on the carpeting. But I can remember, as a medical student, being involved in wheeling patients over and a number of things, but all the safety events that were going on in order to safely have patients. And I can't remember what they did, but I recall something where patients who came to the emergency room, some were admitted to Frederick and some were admitted to county. But I remember that very clearly. So it was the opening of Frederick. And obviously that's gone on to significantly change the character of the campus.
Yeah, it's the beginning of a academic medical center, I think, with Frederick out here. Your path after medical school, I know, and you explained when you didn't decide to be a nephrologist, but where do you go for your residency after you finished here in 82?
So I matched at Rush University Medical Center in Chicago.
I didn't know that.
And I did my internship there, and I did my internal medicine residency there. And I would say that...
So you finished your, would that be the internal medicine residency, you finished in 85?
I finished in 1985,
okay.
That's correct. And then I was asked to be chief resident, so I did that from 85 to 86. And then I decided to go into nephrology. And I would tell you, like many residents, you end up choosing a specialty based on the care that you see people give, the lifestyle, the work and the research that was done. And I would tell you that I was very impressed with the nephrology group at Rush, and I think I made my decision there to emulate. They were very, very smart people, some of the smartest that we had at the medical center. So smart people, good teachers, good research going on, providing good clinical care. And so I think that's why I chose to do nephrology. From a personal point of view, my husband, I told you, had told me that he would pay for me to go to medical school. And our deal was, once I was sort of on my feet, he wanted to quit his engineering job and start his own company.
Cool.
And so when I was probably towards the end of my second year of residency, because I was making so much money, $28,000 or something like that, my husband and I worked it out that he would quit his job, and he had a year to get his own business sort of on the feet and get going. And I look back on it, and it was a fun time because I was in residency and he was starting his company, and just really, it was a way that we continued throughout our careers, both he in engineering and me in medicine, just sort of did things that helped each other grow.
That's neat. It's kind of a synergy type thing.
It was.
Did you do, for nephrology, after the residency, then there was a fellowship in nephrology?
That's correct.
And you did that also at Rush?
I did that also at Rush, and then my first faculty appointment was at Rush as well.
Okay, so that was, you finished the fellowship in what, 87 or?
88.
88.
So I finished in 88.
Okay, so you got it. I mean, and again, I was going to say, I know your history from having lunch with you in the faculty
Room
dining
500.
room at Rush.
Yes.
And so you're on the faculty at Rush, and you have a practice there.
Right.
Are you
Right.
doing some teaching?
So I would tell you that I was a classic academic faculty member. I taught in pathophysiology as well as in clinical diagnosis. I did bench research. I had an interest in diseases of the glomerulus and how they were affected by different toxins, and became interested and worked in transplant nephrology. And I had a clinical practice there. And I would tell you that I was very lucky. I was Teacher of the Year several years in a row, had good support for my research, and had an expanding clinical practice. And the one thing that I remember when I started in practice was that I was the first female to join the group of nephrology. And when I first started, people, they'd say, okay, you have an appointment with Janis Orlowski, and people say, oh, I don't want to see a woman physician, I want to see one of the male physicians. And so this is in 1988.
Yeah,
so we had, it just was the way it was. And, there are other things along the way. And I can remember my partners talking about it and saying, that's it. You're just going to give an appointment. We're not going to say Dr. Janis Orlowski. We're going to say Dr. Orlowski. Once they meet you, everything will be fine. And it went from people actually saying, I don't want to see a woman nephrologist, to years later when we were all talking, and it ended up that 50% of the phone calls to the practice, people wanted to get in to see me.
You.
And so, just sort of an interesting trajectory
Yeah.
in how things change in clinical medicine.
Well, you began your role in leadership at Rush.
I did.
And I noted you had been the senior vice president at the Rush Presbyterian Medical Center. Is that the
Right.
correct name? And then when I had first met you, you're executive dean
Right.
at
Right.
Rush Medical School.
Right.
And what were what was the path to move into these leadership roles? Just being asked, or was that something you saw and said, I'd like to do that, or I think I could be a leader?
I don't think that I consciously said, I want to go into, get into the dean's office, or I want to be a leader. I don't think that had occurred to me. I was, a researcher, I was a teacher, I was a clinician, and I would tell you that there were a couple of things. First of all, Dr. Roger Bone was the chairman of medicine when I was the chief resident. And Dr. Bone ended up giving me multiple opportunities to become involved in committees and events that were going on. And so one of the things to remember is in 1985, DRGs came into being, and people
DRG.
did diagnostic related groupings. Okay. And so it was a different way that individuals physicians and hospitals were paid. And so what's this DRG, what's going on? And so Dr. Bone actually said to me, let's find out about these DRGs, what's going on, what the issues are. Janice, look into this. So I actually looked into DRGs and became involved as a chief resident in utilization review and trying to understand and helping the physicians. So it was a new payment methodology that came in at that time. And Dr. Bone said, go for it, find out more information. I also became involved in other faculty committees. So for example, as a fellow, I was on the faculty executive committee. And so I ended up becoming involved in a number of activities, from rewriting the bylaws to looking at different issues that were going on. And so when Dr. Bone left when he left Rush, he had gone from being chair of medicine to being the dean. when he left,
Is he the gentleman that I met that day when I had lunch with you?
I don't recall. It might have been.
It was an older gentleman.
Was it him or was it Dr. Bruschke? I can't remember. I think it might have been Bruschke.
Yeah, it could have been.
I think so. So, and Dr. Bone had actually asked me to come into the dean's office to do, special projects. And it was interesting because someone had advised me, and I talked to him about it. I said, what'll happen is I'll come in and do special products, but there's no trajectory there. Like, where do I go after I do special projects for a couple of years? And so I stayed as a faculty member, and when Dr. Bone left, Eric Bruschke became the dean. And he actually came and talked to me and said, I've been watching you, watching what you're doing, your involvement, you're rising in the faculty rank, and I'd like you to join as the Associate Dean for Medical Sciences and Services. So we had a Dean for Medical Sciences where the chairs of the medical departments, pediatric medicine, family medicine, neurology, where they reported to an Associate Dean. And then there was an Associate Dean for Surgical Sciences and Services, and then an Associate Dean for Medical Education, and then for Residencies and for Continuing Medical Education. So there were 5, major dean positions, and Dr. Bruschke asked me to become the Associate Dean for Medical Sciences and Services. So that was in my 30s that I became the Associate Dean. And within a couple of years, working with him, learning about the dean's office, learning about the budgeting of the medical school, learning about the faculty practice, I then rose until I became the executive dean of operations for Rush University. And that was both, it held both the medical school as well as a hospital role. So I went from, I went from being an intern to being the executive dean at Rush.
Yes, one of your alma maters. So.
Yes.
And then you left, and I can't remember the year. You obviously can. That you left Rush to go to the Washington Medical Center.
So in 2004, I left to join MedStar Health, which was a system in the Mid-Atlantic area that had their principal hospital being the Washington Hospital Center, 1,000-bed
I knew
hospital.
it was. I should have known that. We have the Washington Medical Center in our records. Even though now that you mention it, I remember it was MedStar.
Yes.
And we'll make sure we change that.
Sure. So it's Washington Hospital Center. And MedStar had just bought Georgetown University Hospital and were integrating Georgetown into their system. So I was the first senior medical leader who was recruited and hired after MedStar bought Georgetown. And I went to be the chief medical officer at the Washington Hospital Center, MedStar Washington Hospital Center, it's now called. And so in 2004, that's what I did. And MedStar was, Washington Hospital Center was a large independent academic medical center at the time, had 35 plus residency programs, had a relationship not only with Georgetown but with GW and with Howard, and is really the large academic center in DC. Has a trauma center, a burn center, neonatal center, just a very, very large hospital. And as I said, in the system, we had just bought Georgetown Hospital, and so our major affiliate and our major partner from that time on was Georgetown. Sure. And so spent the next 10 years working in that system.
And then left to become the chief health officer for the Association of American Medical Colleges.
That's right.
Which gets you back working with all the medical schools.
That's right.
So you kind of, there's a little bit of a, back to where you kind of got involved in a leadership role at a medical school.
So that's right. And so the Association of American Medical Colleges is really, I think of it as 3 different organizations. One organization is what we call the services. So the AAMC has the MCAT, which everyone knows about, and also the electronic application services for medical school and for residency, AMCAS and ARS. And they have a number of other tools that they have on the service side. And then you can think of it as a membership organization with 145 medical schools and almost 400 teaching hospitals. So there's a Council of Deans, the Council on Faculty and Academic Societies, and then the Council on Teaching Hospitals, and as well as a number of other groups for faculty
Right. Well,
and curriculum
people like
support.
Group on Institutional Advancement. I went to the
Exactly.
meetings a number of times.
Exactly.
Spoke at them a few times.
And then the third part of the AAMC is you really need to think of it as a think tank. It's a policy and think tank. So the division that I am the chief over is healthcare affairs. And so we spend a lot of time working with CMS, with the White House, with CDC, with the FDA on policies and regulatory issues. And really, as we're going through a clinical transformation right now, it's how do medical schools and how do teaching hospitals, first of all, transform the clinical care, but also transform the educational program that we have to meet the future needs.
See, as always, you're taking me right into all my questions.
Good.
Which is,
Good.
it's amazing how often that's happened during the interviews, because I was gonna, ask you as chief, health officer, what's your perspective on medicine and academic medicine?
So my perspective on medicine and academic medicine. So my view of medicine is that it's an old profession. It's thousands of years old. And I think that medicine always is, always will be. And what our responsibility is as the current holders of this profession is to make sure that we continue to evolve, not only in medical knowledge, but also medical practice. That's our job, and to teach the next generation. As far as academic medical centers, like many hospitals and many clinical facilities around the United States, we're going through a tremendous upheaval right now. And what I think is that academic medical centers will look very different tomorrow than they do today. And we're seeing some of the testing of that going on. So it's not only the consolidation, we see academic medical centers and other hospital systems having systems and growing in size, but I see us teaching medical students in different venues. I see research occurring in different venues. I see us needing to be more transparent about financial situation. We need to be more efficient in the care that we provide. And I also see greater transparency and greater attention to quality and patient safety. So I think academic medical centers are going to significantly change over the next 10 years.
Well, just prior to that question, you kind of gave me a sense of maybe some of the things that you're doing. And that's what I was going to ask, is what your role is on a national level in your position with the AAMC. I mean, I heard you downstairs after your talk, mention, meeting with politicians and working with policy leaders. And what other things are you doing? You're obviously probably got to be exciting to meet the people that you're working with.
I would say I have a wonderful position right now, it really is a wonderful opportunity. We do spend a lot of time looking at policy and regulations, and I meet a lot of people who are involved in setting national policy and national laws, and we try to influence that and influence that in a positive way. I also spend a lot of time at academic medical centers like the Medical College of Wisconsin, looking at what they're doing, learning. And I not only try to bring best practices, but I learn about these best practices from the academic medical centers. And so we have many forums where we have discussions with people who are involved in the transformation. One of the other things that we're involved in right now is that we are a convener facilitator of an alternative payment program. And we have we are working with CMMI, so it's the innovation arm of CMS that is looking at alternative payment programs. And so we convene between 35 and 40 academic medical centers who are trying out new alternative payment methodologies. Bundled payment program is what it's called. And what we're looking at to see is how can we provide care along the continuum? How is it paid for? How do we improve that care? Another thing that we do is we do workforce projections, and you saw that data and some of that work. And the other thing that we are working on is a program in integrating quality. And so we're taking a look at the basic fundamental curriculum and competencies for quality and for patient safety that we have to make sure that our faculty know and that we incorporate into the curriculum for residents and for medical students. So I would say it's a wonderful position, wonderful opportunity.
You know, the word I wrote down, 2 words, when you were talking about that, and my next question was going to relate to, you know, your AAMC, however, also on our Board of Trustees. I wrote, lucky us with your background. How lucky could we be to have someone on our Board of Trustees with that kind of knowledge and,
thank you.
You know, we're kind of the lucky ones that get to take advantage of your knowledge there. But, you know, with your role with the AAMC and as a member of our Board of Trustees, you've got kind of a unique perspective to look at us, MCW, and to compare us with other medical schools. Is there anything, obviously you're prejudiced as heck as an alumnus, but that you think distinguishes us, you know, not alone, but does distinguish us in our role as a medical school?
Well, I would say a couple of things. First of all, I feel very lucky to be on the Board of Trustees and feel that it's a tremendous privilege to be able to go back. And I always smile as I head up to this school. I remember those days when, you know, I was coming in to take an anatomy class or whatever.
And the flashbacks must be there.
Flashbacks are there, and I think, how lucky am I to be able to, you know, be on the board of my medical school. As far as what I think the Medical College and Froedtert are doing, which is unique, there's a couple of things. You know, first of all, you have almost $200 million in research funding, 140 of external funding. That really is a tremendous amount of dollars, and it tells you the preeminence of research at the Medical College of Wisconsin. It's really, you are distinctive in the amount of research that you do. I also think that you have many programs that you can continue to work and make differences in patients' health care. You have a number of programs right now on population health, looking at preemptively trying to bring care within a community and avoid the acute hospitalization. And I would say your population health, your biostats, your epidemiology has really always distinguished the Medical College of Wisconsin, as well as the cancer programs that you have and the cardiovascular programs. I would say the other thing that is interesting to look at, if I was impartial, is that we're looking at Wisconsin and looking at a tremendous consolidation of care along what we think we're going to see in other parts of the country, so that there are community hospitals that are consolidating behind Froedtert and have a network of care. And not only is it a consolidation of hospitals and ambulatory systems, but you actually are taking a look at specific insurance plans. And I would say you're out front in the leadership that John Raymond and Joe Kirshner and the Froedtert leadership are showing in this is really very interesting, and people are watching what you're doing and watching how you are trying to change care and change care delivery and how you're doing that. I also think that you're being very innovative with your regional campuses. Yeah. And so, the campus that opened in Green Bay last year, or De Pere, I guess is more appropriate, and the campus that's going to be opening in central Wisconsin. This is really taking a look at what the state of Wisconsin needs and saying, how do we answer those needs for physicians within rural areas or within that community. And I think that's very distinctive.
Well, it's definitely an exciting time to be around here.
It is.
The other thing is, again, from your perspective, any opportunities and challenges that you see for MCW?
Well, I think,
And maybe compared to other medical schools, they probably have some of the same.
I think one of the opportunities is to really take a look at what is very disparate healthcare within the city of Milwaukee. And I think that the medical college does and needs to continue to say, what is our role in trying to reduce that disparity? And there is not only significant disparities in healthcare, but there is disparities in opportunity for individuals from the community. And I think that the Medical College of Wisconsin does and needs to continue to play an important role in saying, how do we help lift kids out of that community so that they can have an opportunity in healthcare? And that's very important. How do we deal with disparity in healthcare? If we take a look at zip codes in and around the Milwaukee area, there might be 10 to 15 years difference in age morbidity and mortality between certain zip codes in Milwaukee. So we have zip codes right next to each other that have tremendous differences in health outcomes. And I think the last thing is that you need to take a look at violence and what has been a pattern of violence in Milwaukee. So, and I'm not saying it rests solely on the shoulders of the medical college, but the medical college is the preeminent medical school and academic medical complex in this area. And it needs to be part of the solution with other individuals within the Milwaukee area. So that's the challenge.
That's good. Thank you. No, that's great. Good insight, and and nobody we have coming through our doors sees more medical centers than you do,
Right.
and medical schools. I've worked with you for, I think, a long time, about 20 years. You've been an extremely active alumnus. You've served on the couple terms on the Alumni Association Board of Directors. You've led all your class reunions. You've hosted and attended alumni events. You were named Alumnus of the Year in 2007, and now you're serving on the Board of Trustees.
How lucky am I?
You are. I tell you something. That's a list that's.
How
I don't
lucky
know
am
if
I?
anyone else has had all those things going for them. But can you tell me why you felt it's so important to stay involved with your alma mater?
I am the first person in my family who went to college, and obviously the first person who then went on to professional school. And I think that the Medical College of Wisconsin entrusted me with this, wonderful education, this wonderful opportunity. In some ways, I take a look back and I see this kid who is completely naive. I'm not sure that I completely, I wanted to become a doctor, but what does that mean? And the Medical College of Wisconsin helped me, and I feel a tremendous debt of gratitude. I have had, and hope I continue to have, for years to come, a wonderful life and a wonderful opportunity. I love being a doctor. I still see patients, and despite the fact that I've been in some very senior positions, I continue to see patients. I love doing that, and I intend to do that. And I think, how lucky am I that people sort of, helped me and propped me up and, set me on my way. And so it's just been a privilege, and it's made a difference in what I've been able to do in my life.
Well, and we've appreciated it.
Well, thanks.
The good thing was I always knew when the class of '82 was having a reunion. I knew
You knew who to call.
Or if we needed to do an alumni dinner in Chicago or Washington, D.C., I knew who to call.
Well,
I did want to ask you, before we finish, again, you're relatively, 1 year on the Board of Trustees?
1 year.
Yeah, and how are you enjoying that?
I love being on the Board of Trustees. There's a couple of things that are interesting. First of all, I see a very dynamic board which is struggling, and I don't mean in a negative way, struggling in a positive way to make sure that they're doing the best by the medical college. What do we need? How can we be ahead? How can we skate to where the puck is going? I see a very dynamic board. I'm part of the board at a time when we're making another leap in what's going on at the medical college. So we're looking at bringing in a pharmacy school and tremendous opportunities for growth of a health professional university here. I've had the opportunity to meet some wonderful people from Milwaukee and the greater Milwaukee area in Wisconsin. And I think that we're very lucky to have these individuals committed to the medical college. And I would say it's an exciting time at the medical college, but it's an exciting time in healthcare. For some people, sometimes too exciting, but there's going to be tremendous forces of change. And anything that I can do to help the medical college during this time, I would like to do.
Oh, that's great. And lastly, before we finish, I don't want to keep you from answering or telling me anything else, and that is, do you have anything else you'd like to tell me about? We already got the nun story. So.
We got the nun story. You got the nun story, exactly. So one of the things about the medical college is that there are people who I went to medical school with who are some of my closest friends right now.
You know, that many times I have that question in here, and with all the other things I ask people, have you stayed in touch with some of your classmates?
I have. And I would say they're lifelong good friends and good buddies. And the other thing that happens is even for those people who we may not stay in touch with on a week by week or month by month, when the class of '82 gets together, there's a camaraderie and a wonderful feeling to have been part of that class. And I don't know if that's true of all classes, but it certainly is. And I look forward to seeing my classmates. I really enjoy seeing what they've done, the accomplishments. They really have been a tremendous class. And so
I agree with you.
I feel lucky to be part of that class.
Hey, I've worked with every class from 1945 on reunions through 2005 for their tenure. And the class of '82 is always a fun one to work with.
Good.
So you're lucky to be part of that class. Jan, thanks so much for joining me.
My pleasure.
We appreciate it, and thank you for all that you do for the Medical College of Wisconsin.
My pleasure. Thanks, Bill.